We now have another perspective we're going to bring in. My next guest, Congressman Drew Ferguson from Georgia, was a rural dentist for 25 years. He's currently the Republican Chief Deputy Whip in the House. Let's find out what he has to say about oral health and Medicare. Congressman, it's great to see you. I have to say something. My dentist is a guy in D.C. named Cy Khan. And it has taken decades for me to develop a good relationship with a dentist. And I finally have it. Finally have a relationship. So, so I don't need you for services on that, but I do want to kind of get smarter, on dental care. And as we think, and we just heard Maisha Minter-Jordan, the president of CareQuest Institute, she made a comment that said oral health is health care. And I'd love to get your thoughts on that before we get to the question of who pays for it and how we broaden it, how we get access. But are you on board? Because I'm just interested that we seem to have segmented healthcare into different competitive slots. Where are you on that?
So, well, thanks for having me, and I'm going to make some very brief comments, and then they've called votes, and I've got to get over to the Hill. But let me make a couple of very quick comments here. First of all, dentistry in the past has been something that is healthcare that works because there's a doctor-patient relationship that exists, and we're able to have really good conversations with our patients to provide the care. Here's the challenge that we see with the current Medicare legislation. We see it as an empty promise to seniors. While we recognize that providing care to seniors is important, what we're seeing in this bill is a bill that actually doesn't fund this fully until 8 years down the road. It puts immense pressure on the current Medicare system, and there are no additional revenues coming in to help support this in the short term. So we see this as a majorly flawed product. The other thing that I will say is that when the policy writers were writing this policy, they did not speak to a single member of Congress who is a dentist regarding these policies. We've got something to say about how this should be done, how it can be done. And look, I practiced dentistry in a rural community for more than 2 decades, in a community that was about 62% African American in a economically depressed area. I've got ideas about how to do this, and they simply were not included. And my biggest fear is that this is going to be a promise to our seniors that can't be fulfilled because the entire provider network is going to back away from the program because it looks like it's not going to be able to be sustained. And dentists can't stay in business losing money under current Medicare, under what we anticipate CMS will do with this. So with that, you have my pledge to continue to work on this area to help our seniors. But in the end, what's being proposed right now is an empty promise.
Do you have a strategy or suggestion or an alternative plan? I mean, one of our focuses is how do you reach underserved communities? How do you reach elders? I mean, is the answer to go ahead and upload the payments on the front end of that? Or do you have other things that we ought to be doing when it comes to making health care more holistic and understanding that oral care, dental care is part of a package that, should be part of the American social contract somehow?
Well, first of all, again, I'd love to have this discussion, and I'd love to have it with our committee. But right now, as I said before, I apologize, but I've got to head over to votes. But I look forward to future engagement, and thank you for having me on this very important program.
Really appreciate it.